Hey everyone, and welcome back. First, I just want to remind you of something. You are capable of passing this exam. A lot of students struggle with NCLEX questions because they feel overwhelmed when multiple answers seem correct. But today, I'm going to show you a simple, step-by-step system that helps you slow down, think critically, and approach questions more confidently. The goal is not to memorize everything. The goal is to learn how to think like a nurse. Let's get started. One of the biggest mistakes students make is believing there's some secret trick to the NCLEX. There isn't. Most questions become easier when you learn how to systematically break them down. And that's exactly what we're going to practice today. NCLEX questions feel difficult because multiple answers often seem correct. The test is designed to evaluate critical thinking, not just memorization, and many students panic and rush to choose an answer before fully analyzing the question. That's where mistakes happen. Most students immediately search for the right answer, but that approach usually causes overthinking. Instead, you should focus on analyzing the question, identifying clues, and eliminating unsafe answers first. That shift changes everything. The NCLEX rewards systematic thinking. Instead of guessing, slow down, eliminate wrong answers, and work through the question step by step. When you have a process, your anxiety decreases because your brain knows what to do next. Most NCLEX questions fall into three main categories: priority questions, safety questions, and knowledge questions. If you can identify the question type quickly, you immediately narrow your focus. Priority questions ask, who do you see first? Your job is to identify the sickest or most unstable patient. This is where ABCs become extremely important. Always remember, airway, breathing, and circulation. Safety questions focus on preventing harm. Ask yourself, which answer keeps the patient safest? The NCLEX is always testing safe nursing judgment. Knowledge questions test your understanding of disease process, medications, and procedures. These questions still require critical thinking, not just memorization. Now let's go over our CARE method from our previous module in order to practice with the different types of questions we've just learned. C. CARE. Identify the type of question. A. Analyze. Slow down and look for clues. R. Rule out. Eliminate two answers and compare the final two choices. And finally, E. Execute. Execute confidently. This gives your brain structure instead of panic. As you practice more questions, this process becomes automatic. The goal is not speed at first. The goal is safe reasoning. Speed comes later. Let's begin with our first step. Identifying the question is our first step in the process. Ask yourself, is this a priority question, a safety question, or a knowledge question? Once you identify the type of question they are asking, you know which pathway to go down. Now look carefully for clues. Focus on symptoms, vital signs, and key words like first, best, or priority. Those words guide your decision-making. With that same reasoning, beware of words like always or never. Nursing rarely deals with absolutes. Next, remove obviously unsafe or irrelevant answers. You're usually able to eliminate at least two choices immediately. This simplifies the question dramatically. Now compare the final two answers. Ask yourself, which answer is safer? Which answer is more immediate? Which prevents harm? And which answer best matches the original question? And finally, settle on your answer, trust your reasoning, and move on confidently. Second guessing often hurts students more often than not. Let's go ahead and practice this. Which patient should the nurse see first? A patient with chest pain? A patient with a fever? A patient requesting pain medication? Or a patient needing a dressing change? First, identify the type of questions being asked. This is a priority question. Now let's look for clues. Since this is a priority question, let's apply our ABCs. Chest pain is a symptom involving circulation. Having a fever is a symptom, but is usually less immediately life-threatening. Pain medication requests and dressing changes are interventions, not immediate emergencies. Now eliminate two answers. We can eliminate pain medication and dressing change. Although important, we should make a note to complete those tasks after we assist our priority patient. Now compare the final two using ABCs. Chest pain affects circulation. Fever does not currently suggest an ABC emergency. Let's execute. The patient with chest pain should be seen first. Always ask yourself, who is unstable? What is the biggest risk? What is most urgent? That's how nurses prioritize safely in real life. Some common NCLEX mistakes students make include rushing, overthinking, ignoring keywords, and constantly changing answers. Trust your process. You've studied and prepared yourself for this moment. Remember, the NCLEX isn't about memorizing everything. It's not trying to trick you. It is testing safe clinical judgment. You absolutely can pass this exam. Stay calm, think systematically, and trust the process. Every question you practice builds stronger critical thinking skills. Trust yourself. You know more than you think you do. You've already made it through nursing school, and that alone proves your resilience and capability. Thank you so much for watching Module 2 of our NCLEX Breakdown series. In Module 3, we're going to break down two types of NCLEX questions, priority and delegation. Keep practicing, keep improving, and remember, you've got this.